Welcome to Lesson 2.2, Measuring Health Status. This lecture is going to be very important for your group project. You will be picking a country and looking at the health status of the country, and you will be using these key terms to do that. So let's look at the key health indicators. So as we've talked about before, it's really important to use data and evidence to understand and address global health issues. And this is a part that we get from public health, the importance of using that data and evidence. And so why do we need to measure health status indicators? Well, we need to find out what conditions people suffer from. And for those conditions, are people just getting sick? Or are they being disabled by this condition, or are they actually dying from it? So let me give you an example of someone having a heart attack. Is it just morbidity? So they've just become sick with a heart attack? Have they had a heart attack and then had a stroke? So are they disabled? Or did they actually die from the heart attack? So it's determining the causes of those health conditions. Second is carrying out disease surveillance, and we've seen this loud and clear with COVID. And so it's important to understand where people are getting infected, who is getting infected, and what may be done to address these conditions. It's very important to make comparisons about health within and across countries. So why are certain countries healthier than other countries? Can we learn from those countries? Do we need to put more resources into certain parts of our own country? And so that's very important. And so in order to look at these key health indicators, we've got to come to some type of term of some consistent set of health indicators that all countries can use. So these are the key health status indicators that typically countries will use to look at the health of their country. Infant mortality rate, life expectancy at birth, maternal mortality ratio, neonatal mortality rate, and the under 5 mortality rate or child mortality rates. And so when you're looking at a country, these are the typical status indicators that you will see. And we will discuss other ones as well, but these are the key ones. And you'll also see in your textbook that these key indicators of health status are looked at in two different ways. They're looked at first by the World Bank region and second by the country income group. And you'll see that as we move through some of the graphs. You'll also see that there's a very strong correlation between country income level and health status. So for instance, the lower the income group, the lower the status. The higher the income group, the higher the status. As well, in all cases, Sub-Saharan Africa has the worst health indicators of all the World Bank regions, and South Asia has the second worst health indicators. You'll also find out as you move through the next 12 weeks that the low health status of Sub-Saharan Africa and South Asia is related to the fact that these are the two regions with the lowest per capita income. But a lot of it has to do with government policies and programs, low levels of education, and a host of other factors that we will discuss. And it's also really important to understand that a country's income level does not have to determine a country's health status. And I'll talk a lot about this when I talk about my work in northern Ghana, which is sub-Saharan Africa, which is a very low-income country, and we've done phenomenal work with health status there. Okay, so let's look at life expectancy at birth. So what does that mean? So life expectancy at birth is, and I'm quoting from the book, the average number of additional years a newborn baby can be expected to live if current mortality trends were to continue for the rest of that person's life. And so as you can see in this chart here, when we're looking at income level, so life expectancy at birth by country income level, you can see that in the low income, the life expectancy, if things were to carry on as they are, would be 63, and high income countries is 81. And if we go on to the next slide, this is looking at specific regions. So life expectancy by region. Again, you can see Sub-Saharan Africa and South Asia are 60 to 69 life expectancy, and North America is 79 life expectancy. And so when you're thinking about global health, you would want to understand, why is it that the life expectancy is so much lower in these countries? So next, let's look at maternal mortality ratio. So this is a measure of the risk of death that is associated with childbirth. And as you can see, it's a ratio. It's the deaths per 100,000 live births. And again, you can see low-income countries is at 496 deaths per 100,000 live births, whereas as high-income countries, you can see it's 10. If we look at maternal mortality by region, again, Sub-Saharan Africa is the highest, with South Asia being second, and then North America at 13. A big reason for the high maternal mortality rates is the lack of facilities for obstetrical emergencies. And you can see there's a huge increase from North America mortality rates to Sub-Saharan Africa. It's at 42 times higher between those countries. So that's very, very significant. Next is the infant mortality rate. And so the infant mortality rate is the number of deaths of infants under the age of 1 per 1,000 live births in a given year. And so you can see that it's expressed in deaths per 1,000 live births. And again, you can see the differences between a low income and a high income country, as well as the difference in infant mortality between regions. And so again, Sub-Saharan Africa, South Asia being the highest, and North America, Europe, Central Asia being the lowest. Infant mortality rate is a really powerful indicator of the health status of a country. But maybe you didn't know that most children younger than 1 year of age actually die in the first month of life. And that's why what's also looked at as one of the key indicators is the neonatal mortality rates. And so death within that first month of life, or the first 28 days of life. And so again, you can see the stark difference in depending on income level of a country and between specific regions. So again, the same things that we're seeing with South Asia and Sub-Saharan Africa being the highest, and North America, Europe, and Central Asia being less so. So I want to take you on a little field trip. So the Leyaata Ane Project is a project that my NGO has been involved with since 2014. And we became involved in this project because it was identified in the northern region of Ghana, no surprise, Sub-Saharan Africa, low-income country, that they had high rates of maternal mortality, they had high rates of infant mortality, and high rates of neonatal mortality. And this was brought to the attention to us by women who were witnessing this. The numbers were extraordinary. And so we developed this program with the help of community health workers and mothers in these regions, called the Leyaata Project. And then it's now on to the second phase of the Leyaata Ane Project. And so you can make a difference in these low-income countries. And I'm going to show you quickly, and you can come back and look at this. Okay, so this is the organization that I work with, GRID and NEA. This is our Leyaata Ane Project. And as you read through this, you can see that we first started our project in, 2011 to 2014. And it was called the Leyaata Project. Leyaata in Ghanaian language means rescue us. And the reason we started this project is that mothers in these communities were witnessing newborn death rates very high in these communities. And so what we did was we involved community health workers, we involved community volunteers, health workers, women and newborn babies. These are the women that were in our project. And what we did is we started supporting these health workers with the basic tools to how to resuscitate a baby. And so these health workers in these rural communities, we brought all this equipment with us, and we simply taught these community health workers and mothers in these remote villages how to resuscitate a baby, how to nasally aspirate, how to use an ambu bag or the bag valve mask bag to help a baby breathe, because they didn't have these facilities. And so that was one part. And we also worked with mothers in that we encouraged them to make sure that they choose safe childbirth and that they go to a health facility to give birth there. And we provided these rural communities with the proper emergency obstetrical equipment that they needed. The second thing we did was these community health workers that were trained, we made sure that the community health workers followed up with mother and baby prior to giving birth to make sure that the mother was doing well in her pregnancy. And then we also taught the community health workers how to manage a baby in the first 28 days of life. What are the things that you should be looking for that a baby is not feeding well? Is there an infection? Is the baby's respiratory rate high? Is there a pneumonia? Things like that. And we have seen unbelievable results from this. Our neonatal death rates and our infant death rates and our maternal mortality ratio has significantly dropped. And so it can be done. You can drop these rates by just teaching these women how to resuscitate a baby, how to care for themselves, and to ensure they go to a medical facility to give birth. So I will go back to my lecture, and you can read more about that. So just moving on, the other health indicator that you'll quite often see looked at is the under 5 mortality rate. And this is the probability that a newborn will die before reaching the age of 5. And it's expressed as a number of per 1,000 live births. And so there are a number of reasons that children die under the age of 5. A lot of it's to do with malnutrition, not being vaccinated against certain illnesses. Pneumonia is very high, impure water and sanitation, so children are becoming sick for that reason. And we're going to learn a lot about these reasons for the under 5 mortality rates. And so again, no surprise, the differences between low income and high income. And again, the same things that we're seeing with the sub-Saharan Africa and South Asia, your higher rates, and Europe, Central Asia, and North America with your lower rates. And so these are some of the key health indicators that you will be looking at as you read research and are researching things for your own project. And then this is just looking at those, under 5 infant and neonatal mortality rates by the income groups. So just another way to look at these key health indicators. Other key health indicators that you're going to be looking at are morbidity, mortality, and disability. So morbidity, again, is just that sickness. Mortality is death, and disability is temporary or long-term reduction in a person's capacity to function. So again, you could be a diabetic, you could have pneumonia, and is it just a morbidity thing that you've just become sick with pneumonia? Is it a mortality? Have you died from pneumonia? And did you have some temporary or long-term reduction in the capacity to function because of pneumonia? And so looking at those, it's a different way to look at health conditions. Other ways, you may have learned about this already, but we see this a lot in global health, looking at the prevalence and the incidence. So again, prevalence is the number of people suffering from a health condition during a specific period. So it's all those people. And then incidence is the rate at which there's new cases. So incidence relates about those new cases of a disease. And so typically what we would want to see is if we're doing some really great global health efforts, we would hope that the prevalence would decrease and the number of new cases would decrease as well. Other key indicators that we look at as well are primary prevention, so intervening before the health effect occurs. Secondary prevention is that screening part to identify disease before the onset of signs and symptoms. And then tertiary prevention is managing that disease post-diagnosis or stopping the disease progression. So I'm sure you've learned about those in your community course. And then when we start looking at the burden of diseases, this is how typically things are categorized. They're categorized in three ways. As a communicable disease, so these are health conditions. Again, a communicable disease, think about infectious diseases. Then we categorize health conditions as a non-communicable disease. So these are your heart disease, your cancers, your COPDs, mental health is in here, and then injuries is the second category. And we'll look we'll look in detail about these three key indicators when we talk about burden of disease. Lastly, I want to talk about the importance of vital registration. So vital registration systems record births, deaths, and causes of death. And you can understand that many low and middle income countries lack a vital registration system. And so a lot of the work with global health is trying to assist those low income countries to be able to record these birth rates, death rates, and causes of death. And so it's really important to have an accurate system to ensure you have quality data on a population. And oftentimes there are cultural barriers to timely vital registration because many people in countries wait until a child is a certain age before registering the birth. And also with lack of access to vital registration is another example of not being able to record that data. And sometimes there's enormous difficulties with accurate indications of causes of death because they have weak healthcare systems and not a number of well-trained physicians. And so for a lot of the regions, you may not know why someone has died. So what is the cause of death? So just some things to think about with that. So the main messages, so again, it's important to understand global health issues, and it's very important to look at global health issues by understanding the determinants of health. And we talked about determinants of health and what they are. We talked about that in lesson 2.1. We talked about in this lecture about health data and how it's used to measure health status, to carry out disease surveillance, to make decisions about health investments, and assess health program performance. Sub-Saharan Africa and Saharan Africa have the lowest health status. Sub-Saharan Africa has a unique profile of young child deaths, and the risks are equally spread across neonates, children, and adolescents. In high-income countries, the majority of child deaths are among neonates and related to neonatal conditions, and there are substantial disparities between the better off and the worse off regions and income groups, and that is where we come in as change agents and thinking about social justice and health equities. So in lesson 2.3, we will look at measuring the burden of disease and risk factors.